But quite apart from that, in terms of the specific debate and a more general debate, the issue about, you know, in the jargon, aligning incentives and you know, rewards going to innovators, and how what Bernard has called our internal market handles that or doesn't. I mean, these are all things relevant, clearly, to the analysis and thought about the new white paper. So clearly what we're now going to do is move directly on to the panel, and can I invite everyone? Wendy, if you want to come up too. I will introduce very briefly those who have not hitherto been introduced. So, or maybe actually I should be very democratic and invite you to do that yourselves. I've been would you like to, Andrew, to introduce yourself? I'm delighted Andrew Lockhart Mines is here with us this afternoon. But in terms of the work you've done with the NHS, would you just like to say a little bit to the group?
Good afternoon. I'm a solicitor and I specialise in NHS regulatory law, statute law and contract law affecting practitioners.
Thank you very much. And Dr. Chand? No.
Good afternoon. I'm a GP. I practice in North London. I'm representing the British Medical Association here today. I'm a negotiator on the BMA's GPs committee, and I have a lead role in commissioning. I'm also a member of the BMA Council.
Thank you very much indeed, Chand. Obviously, you've just met Tahir and Bernard, so I'm delighted that Wendy Savage is here this afternoon. Wendy, would you like just to say a little bit about yourself?
Well, I worked in the NHS for 25 years before I retired as senior lecturer in obstetrics and gynecology, so I was interested in the caesarean section thing, and I wondered about the hospital that actually went up afterwards.
One did, yeah.
Yes. And since February of 2008, I've been running an organisation called Keep Our NHS Public, which was started in 2005 with the National Health Service Consultants Association, the NHS Support Federation and Health Emergency, when we saw how the NHS was being made into a market by stealth. And Bernard was talking about the internal market. It's not just the internal market, there's an external market. And the marketeers, the businessmen, are all out there just licking their lips over the white paper.
Okay. Thank you, Wendy. Thank you. We've got a number of questions, but I mentioned earlier this afternoon, you know, the flavour of some possible questions. Some are on your programme of the most general sort. Some are specific, but I'm not going to say any more because I don't want to limit the time. And I'll call on this gentleman here. You may ask, you know, a question to anyone and everyone or to an individual. I'll just try and handle that as pragmatically as I can, if you don't mind.
Thanks very much. I almost fell asleep for the first all morning, apart from your contribution, of course, Chair, until I heard the last two speakers. And they tell me something. They tell me that the NHS is complex. They also tell me that it needs time to provide care to patients, whether it's in primary care or in hospital care. We're dealing with an integrated service. We need good patient outcomes, and the marketisation is dangerous. My question, first of all, is to people who've come here. Some have come from PCTs. They are going to, over the next 3 years or so, lose their jobs, get their redundancy pay, join a private company in order to do the work for the GPs. For the GPs themselves, and there'll be some of them here, they will have this problem that we want them to concentrate on their clinical work, and they're supposed to do commissioning. Can they set up a contract? Can they set out a strategy for their commissioning? Can they set out an action plan? Their job's to look after specific patients and ensure that there's continuity of care. So I ask you, given the complication of a health service, and health is not a commodity. I heard somebody talking about customers this morning. We're all patients at some time, And the real issue, and what worried me about this conference, until you allowed these questions, time, Chair, was shouldn't we be discussing how the health service should move forward? Shouldn't we be discussing whether it's appropriate to go through with a white paper, which is not yet into a health bill, but that'll come soon? And should we not realize it wasn't in either of the coalition parties' manifestos, and it isn't in the agreement that the two parties said? So a real question, I'm from Keep Our NHS Public like Wendy is, but it's a fight to keep quality of care, because all the examples that were given there show that if you have a good organisation system, that you take the doctor's example there, it should be shared around the country for similar conditions. Likewise, the innovations which are successful should be shared around. What I discovered on coming into the NHS was the reinventing the wheel syndrome, and that's a danger. Thank you.
Okay, thank you. Obviously, there's a lot of issues there, John, and thank you for that. Can I just say, can speakers introduce themselves when they, and you're John Lippitz. Absolutely, that's fine, John, thanks. And in future, can everyone also introduce themselves? There's a hell of a lot there. I'd just say that, I personally think it's absolutely appropriate to discuss whether and if, as well as how, about the new white paper, because clearly it is a white paper. It's not an act, and even if it is an act of Parliament, then we live in in many ways a free society and are entitled to give our opinions of it. I mean, the short article, very short article I have in the Public Servant magazine to accompany this conference raises my questions about whether it's an appropriate thing to do or not. So absolutely, of course, it's appropriate. Some of your points, may be taken up by others on the panel. Does anybody want to come in on that one? On the question, maybe we can cast it in terms of integrated care. This morning, Bernard, for example, we were talking about the issues around the new version of the market we're going to see, whether Monitor, for example, will allow primary care to work with secondary care without describing it as anti-competitive or something. So there are practical things. What's actually going to happen? It's a bit of reading the runes, isn't it? I don't know, Bernard, do you want to comment on that?
Well, I'll say two or three things. I mean, I've worked in the NHS for 32 years, my family before me. I love the NHS, and I'm very proud of the NHS. And I'm fortunate enough, because of the job I do, to know that almost all of the people I meet internationally are extraordinarily jealous of the NHS that we have. Having said that, I don't believe there was a golden age in which, without incentives or other things, the NHS universally delivered the sort of patient-centred care which Tahir was talking about, with the quality and consistency of outcomes that our patients all deserve. Secondly, in relation to the issue about commissioning, we have work which I think is very credible and strong work, which shows an extremely strong correlation between an NHS's organisation's scale of engagement of its medical staff in the work of the organisation as a whole and the quality of outcomes from that organisation. So whatever the mechanism, I think ways of getting doctors in particular, but other clinicians too, more engaged in the direction of NHS organisations is something that I think is an evidence-based policy. And finally, I know from my organisation that we have many things to learn from organisations in the private sector of all sorts, not healthcare, but other sorts too, as to how we can deliver safe and reliable care. And we learn a great deal in my institute's work from high-risk industries like the nuclear industry and the gas industry about improving the quality of safety of patient care. And I'm very happy to bring that learning into the NHS. But I want the NHS to be universally available to all the people of England. I'm not going to get into the details of whether this particular policy approach is necessarily the right one. But as long as I'm working in it, my job will be to try and improve the extent to which good practice of the sort that I hope I've described to you is universally delivered across the service.